Over 15% of adults in the US are estimated to have chronic kidney disease. The prevalence is a little higher in women than in men when we look in the general population, and of course, much more prevalent among older individuals. But up to 90% are undiagnosed, and even about 40% of those with severe chronic kidney disease are undiagnosed. When it comes to the prevalence of anemia itself, anemia is much more likely to occur in patients with chronic kidney disease, about 2.5 times as likely. This slide is showing a retrospective analysis of hemoglobin levels in patients with chronic kidney disease, about 22,000 people. And what you can see is that almost a quarter of patients with non-dialysis dependent chronic kidney diseases, overall stages 3A to 5, had anemia defined by a hemoglobin less than 10. But the prevalence increased as the CKD stage increased as well, from 18.2% down at stage 3A all the way up to 72.8% at stage 5. So the majority of patients with advanced CKD have anemia. And in terms of the consequences of that anemia, the first one we think about is symptoms. Patients experience a lot of symptoms with anemia. They tend to shake out in a couple of domains, in particular, weakness, tiredness, low energy, or you might call that fatigue, these first ones. And then the second would be shortness of breath during rest or activity. And then the last is sometimes a cognitive domain with difficulty remembering things, etc. And then physical and emotional impacts can include difficulty standing for long periods of time, difficulty sleeping, needing breaks and naps, and feeling distressed and burdensome. In terms of the impact of CKD-related anemia on long-term health outcomes, we can think of this in a number of things. We talked a little bit already about the reduced health-related quality of life, but there's also a higher risk of volume overload and heart failure. And there's also a higher risk of hospitalization and mortality, which I think is really important given the already high rates of that among patients with chronic kidney disease, just to recognize that it's higher yet among those who have anemia. This slide is just to highlight some of the associations between risks of CKD and CKD anemia and how those may fall disproportionately among members of certain race ethnicities group. First of all, CKD risk is much higher among Black, Hispanic, and Native American individuals compared with members of other race ethnicity groups in the US. There's a much higher rate of kidney disease, probably in part because of higher rates of diabetes and hypertension, and then also a higher risk of kidney failure. Incident dialysis is almost 4 times higher among Black than white individuals, and also 1.3 times as high among Hispanic and 1.2 times as high among Native Americans as well. And in addition to having a higher burden of chronic kidney disease, they're less likely to receive optimal treatment of their kidney disease, in particular, transplantation and home dialysis. And those treatment disparities are most pronounced among our youngest patients. For example, Black patients with CKD are about 2.5 to 3.5 times more likely to have CKD-related anemia compared with others. So higher burden of CKD itself, and then a higher burden of anemia with CKD.